So good morning, everyone. And once again, a very warm welcome to our monthly Empower Hour. And as all of you know, Association of Nurse Executives India is committed to preventable zero harm. And we continue our journey and our endeavors to ensure that we support nurses and nursing students to become more safer practitioners. So with that in mind, this year in 2023, we had decided that we will take one safety event and that will be discussed in the form of a role play so everyone can understand the event and how to prevent them in future. And so far, the feedbacks have been great from the audience that it has been very useful. It's kind of an experiential learning, and we continue on the same journey. And just give me 1 second before we start with the deliberations. So, friends, let me just go there. So these safety events have been taken from a collection of 101 safety events that the Education Committee of ANEI have collected. And hopefully sometime this year, we should be able to publish the book. Also, it is now with the publishers, and we are very proud that we should be able to do that. And this month, we are having our Kerala chapter hosting the event in a role play manner. But today we have something special. And before I tell what is special, just a quick one. Remember that Annie's website has already uploaded all the videos of ANECON 2023. So you can go and look at any track that you would like to. It had been a great event. And there was a lot of learning, which is there very good for you readily after in the ANECON. Multidisciplinary discussions have been held. So it is there all for you there. And also the ANEI newsletter, July 2023 has been uploaded on the website. It's a special edition and the report is on ANECON 2023 very quickly. And thank you for being here. We already have 42 participants, and a shout out to all the people who are not our members that please join us, strengthen us, and give back to your fraternity. This is very, very important. And there are many things that we ANEI do. So you can be part of that. Now, without any delay, before we invite the Kerala chapter, headed by the chapter president, Manju Kannan, it gives me extreme privilege to invite Ms. Madhavi Chikle, who is an ANEI member and she is also the 2023 awardee, Florence Nightingale awardee, and we are extremely proud that the private sector Madhavi has received this award. And before we do the Empower Hour, I would like to invite ANEI's national president, Captain Ajita Nair, to felicitate her before we get into Empower Hour this year. And thanks to the Zoom, I keep telling this that we are very quickly able to meet each other wherever we are. So once again, a warm welcome to all the audience who are present here. And now I request Captain Ajita to say a few words and felicitate Madhavi. Thank you.
Is Madhavi here?
Madhavi was here. Madhavi?
I'm not able to see her on screen.
No, she came in and she checked.
We should have her. I'm unable to see her.
I'm here, ma'am.
Yeah. Good morning. Very good morning. Good morning, everyone. It's my pleasure and privilege to be here on this forum as President of Association of Nurse Executives India and felicitating one of our colleagues. That's indeed a pleasure. Ms. Madhavi Chikle. She had been the president of Punjab Chapter of ANEI, and she has been awarded the most coveted, the highest government level award, which is the Florence Nightingale Award, which is bestowed onto her by the President of India, Ms. Draupadi Murmu, the other day. Many of us have seen her live on the screen. And at this juncture, I would like to say that Madhavi is one of the most active members of us, and she is probably the most pleasant and visible face in all the forums which is on the screen, and one of the most active member. And besides that, she has special ability to be, I mean, how you see her now is how she always looks, very pleasant, very interactive, and to her contributions to Punjab chapter is what she has been provided with this award. And it's a matter of great pride for us as ANEI and as private sector nurses. Because usually what we have seen is most of the awardees, every year there is Florence Nightingale Award given to many nurses, and most of them, a vast majority of them are from the government sector. So now they have probably realized the contribution of private sector nurses to the national healthcare scene. And it's a matter of great pride that our colleague Ms. Madhavi Chikle has bagged this award. And on behalf of all the ANEI members and the nurses in private sector, I would like to congratulate her and felicitate her for bagging this coveted award. It is indeed a matter of great pleasure for all of us to say that one of us have got this award, and I'm sure this will motivate many nurses in the private sector to continue what they are doing, and probably to contribute more to healthcare and to be known and recognized by the system. So this kind of awards probably give all of us a sort of confidence, sort of recognition feeling by the government, actually, because this is given by the central government, in fact. And we are very proud of you, Madhavi, and may you continue to contribute to ANEI. I know that you have recently moved from Punjab to your hometown, Mumbai, and we would expect that you continue to contribute to us and make many more members. One of your achievement was to add to the numbers of ANEI members in the Punjab chapter, and also connecting everybody. You have that amazing ability of connecting to people and bringing them to your life. So a lot of people have told me that you have introduced them to ANEI, because I do contact or call up all the members when they join, and you could increase that number. And I would request you to continue with that great job of adding to the strength of ANEI wherever you work. She's yet to join somewhere and taking a break, probably, is it? And I'm really very happy on behalf of ANEI to congratulate you, and looking forward to more contribution from you, Madhavi. Over to you. Thank you so much. Thank you, everybody.
Thank you. Thank you, Captain.
Thank you so much, Ajita ma'am.
Go ahead, Madhavi.
So thank you so much for this. It means a lot, because to be very honest, I am still, the feeling is still sinking. I am still sinking with the feeling what has actually happened to me on 22nd of June this year. And just looking at the way all the nursing leaders are appreciating this, they're calling now, they're talking, and it is really huge. It's really huge. So let me share one small thing with you all. It was way back in 2017 when I was being participated for my Mumbai to Pune run. That is 160 kilometers in one of the stages, and on the same stage there was a Florence Nightingale awardee of that same year, 2017, being felicitated. So it was Asha Mahajan, and I just met her there. I was totally amazed. I said, "What is this? That little beautiful medal that she had on her apron?" I said, "Ma'am, what is this?" That time she said that is this the Florence Nightingale. I thought, as ma'am rightly said, it was. I had a perception it was only meant for the government and the public sector nurses for their hard work. But that is where I came to. I started and I decided that I would like to have that once. I made it a dream. I made it my vision that one day, I didn't know when, but one day I would be working for this, and I started working for it since then. And on the same year, a very wonderful thing happened to me. I was very much connected to Tanka ma'am, and he shared with me there's something coming up like Annie. You know, she said we founders, we are coming. I don't know if you remember, that was in Pune that she shared this with me, that in 2017 that Annie is coming up. There's something, and we'll let you know. You can be a part. But to be very honest, being with Annie and being with you all has only, has only nurtured and nurtured me to do more. And it always gives me the enthusiasm to do more and love to connect everybody. Because this is where I learn from you all leaders. The things I pick up from each one of you, it means a lot to me. And on the stage, when I'm seeing you all here, and you all are appreciating the fact that one of the nurses among the private sector is being awarded, it means a lot. I'd like to add one little more thing over here. So the wind under my wings was Captain Sanjay Shankar, because I still remember when I expressed my desire that I would like to, I'd like to go for it. And then I got busy with the operation duties and all, and she was the one who said, "Have you done it?" That little inquiry, that little question to tell me, and her enthusiasm that, okay, what are you, where are you? The follow-up meant a lot to me. It meant a lot to me. So just letting you know a little bit of inspiration and appreciation means a lot and takes you a long way. So thank you once again, Annie family, for having me here, and thank you each one of you.
Thank you, Madhavi, and may God bestow upon you many more awards and recognitions, and may God bestow upon Annie more members who will go and reach out to their maximum, and then we will have more opportunity to celebrate together. Thank you so much. And thank you, Captain Ajita, for being here and felicitating Madhavi. Thank you so much, and wish you all a good day. And now it is time for me to invite Kerala chapter. And so let me, we have a slightly larger team discussing today's case study. So before I hand it over, just give me a minute. As usual, I will try to share the case study for today. Just give me a moment, okay? So we finished with our beautiful President and Madhavi segment. So next is, we do have the Kerala chapter who is going to do the role play on the case study. It is going to be, coordinated by Ms. Manju, President of Kerala chapter. I really don't know who is playing what role. That is, I'm leaving up to Manju to tell that. We have Lieutenant Colonel Isha K, Vice President, Kerala Chapter. We have Ms. Bina CA, ANI member, Mr. Lee Jo, ANI member, Ms. Major Elsa Jose, ANI member, Ms. Kalamol R. Sureshan, ANI member, and Ms. Neetu KV. She's not a member, she's a young nurse, and I really hope by the time we finish Empower Hour, she'll say, I really want to be ANI member. I really hope so. That is what we all are here to create more members. So the case study today is like this, that, Miss Lakshmi, 64 years old, patient of cancer, and she's supposed to be biopsy done in the OT. She belonged to a rural background and was unaware of the procedure she was about to undergo. She was restless as she had to wait for a long time, and after some time, the doctor in the OT called her Lakshmi, and she was very happy that her name had come, and so she went inside the OT number 2 for the procedure. The doctor and the team started the procedure for cystoscopy. The doctor was kind of confused while doing the procedure. Lakshmi's bladder seemed perfectly normal and showed no signs of cancer. After completing the procedure, he asks for the patient's full name and tells her to give details. To their surprise, they identified that they had performed the wrong procedure on the wrong patient. There was another patient by the name of Lakshmi who was to be taken for cystoscopy. Now, this is something that many hospitals will be dreading, that it should never ever happen. And I'm very sure that none of us want this to happen. And just for everyone's, it's a disclaimer that this case is taken from our collection. It is not related to anybody who is taking part in the discussion today. So we take one case study from our collection, and our chapter members, they discussed on that particular case study. So before I hand it over to Manju, one last request to everyone here: join us, empower us, and make yourself also empowered, because ANEI stands for Empowering Nurses and Nursing Students. Thank you for being here. And in the August month, we will have episodes being hosted by Maharashtra chapter and MP chapter on alarms and medication error. So we hope to see all of you in the future, empower hours. The word itself is empower. We learn from errors and make our, care more safer for all our patients. With that, I hand over to Ms. Manju from, she's the Kerala Chapter President. Welcome, Manju. Please introduce your team members. Thank you.
Thank you.
There is some echo coming, Manju.
Sorry for the inconvenience. Thank you, Madam Tangam. We know the monthly Empower sessions are possible because of the master brain, Madam Tangam. A big thanks to you, Madam.
Thank you.
Good morning to all. I am here to welcome all of you to the Empower Hour session hosted by Kerala Chapter. We know learning from errors makes our practice safer. Ensuring patient safety in the OT begins before the patient enters into the operating suite. Today, we are conducting a role play based on a topic, wrong side surgery. This scenario is already explained by Madam Tangam. With immense pleasure, I invite my team under the leadership of Madam Beena, General Manager, KIMS Health. On behalf of ANEI Kerala Chapter, I welcome all the participants. Stay muted. Doubts will be clarified at the end of the session. Madam will introduce all the participants. Over to you, Ma. Thank you.
Thank you, and thank you, Madam Tangam, for such a great learning experience. I always feel these role plays are the best way to learn things from and also from errors. So let me introduce the team of the role play. I am there as GM Nursing, and Major Elsa as a ward nurse, Needu KV as a OT floor nurse, Kalamon R. Sureshan as scrub nurse, and Lijo quality manager. So good morning to all. So as the scenario we have seen, we had an untoward incident that could not have happened, but it happened with the serious consequences. A wrong patient was taken.
Excuse me, Ms. Beena, I'll just take one moment. I request all the panelists to stay on the video. Elsa, Isha, Kalamol.
Yeah.
People should not get confused who is doing the role play. When you come in and go, the audience can get confused. So please stay on the video, all the panelists. Rest all the people will be, kept off the video. Neetu, please stay on the video. Sorry to interrupt. Please continue, Beena.
Yeah, that's okay. So, so we had an incident that in OT which should not have happened, but it happened. So we will just see how did it happen and what went wrong. What was the procedure that happened through a video in the OT that happened. So, Lijo, can you play the video?
Was that okay, ma'am?
Yes, we can hear now.
Hi, good morning. Can I speak to the OT administrator?
Oh, sorry. Administrator in the meeting. You can talk to me and I will convey the message to her.
Okay, Neetu. Actually, I called to inform you that we had done a cystoscopy for a patient, Miss Lakshmi. But after the procedure, I identified that we had done the procedure on the wrong patient, unfortunately.
Oh my god. But how can it happen, doctor? Okay, anyway, I just check the OTs first. You just hold on, doctor. Oh, actually, we have two patients named as Lakshmi. One is posted for a cystoscopy and another is posted for the cervical biopsy.
Yes, sister. We had done cystoscopy for the patient who was posted for cervical biopsy.
Okay, doctor. I will surely inform this to the OT administration and she will call you.
Okay, thank you.
Morning. Neetu here. Ma'am, I had a bad news to inform you. I got a call from our surgeon informing that we had done a procedure on wrong patient. Actually, ma'am, we have two patients named as Lakshmi. One was posted for the cystoscopy and the other for the cervical biopsy. By mistake, we had done the cystoscopy for the Lakshmi was actually posted for cervical biopsy.
Okay, we just had an incident, very bad incident, which could not have happened. And I don't know how do we communicate to the patient also. Is absolutely not accepted from our side. So let's see how it happened. Elsa, are you there?
Yes, ma'am.
Where was this patient admitted? Is in your floor?
Yes, ma'am. She was admitted in my ward, ma'am.
Okay, this patient was assigned to you, and were you supposed to shift the patient to OT?
Yes, ma'am. Ma'am, Mrs. Lakshmi, she admitted for biopsy 2 days back, ma'am.
Okay.
And I was on night duty, and after taking over from the evening duty, I have gone through her case sheet thoroughly. And by 8 p.m., the duty surgeon came and ma'am, he obtained a consent after explaining the procedure to the patient and clarifying her doubts. On the day of surgery, morning, I have prepared the patient, and then I have filled all the preoperative checklists, ma'am. Then I have tied an identification band to the patient in which her name, particulars, and procedure was written, ma'am. And when my ward in charge came, she cross-checked all these things, and then I shifted the patient to the OT, ma'am.
So you shifted. How was the patient while shifting? Patient was okay.
I felt she was nervous, and on the way to OT, I counseled her also, ma'am.
Okay, patient was nervous. So you took the patient to OT and you handed over to the floor nurse. Is it right?
Yes, ma'am.
Okay.
Ma'am,
Okay.
when I reached the OT, the preoperative area, there were some patients waiting, and outside the area, patient relatives were waiting. Means it was little crowded, ma'am. So I felt there may be distractions while at the time of handing over. So I told Lakshmi to sit in the preoperative area, and then I went into the nurse's room, ma'am. There I handed over the things to the Miss Neetu was there. I handed over things to her with the case file, ma'am. I thought after detailing the case file, I will show her the patient. But by the time I was handing over, she got a call from OT and she went into OT. So she told she will see the patient later. So, and if some doubt is there, she will call me. So I came back to my ward.
Okay. So you thought it was better to have privacy for the patient and made the patient sit and hand over the file by file to the OT nurse. So thought better for the patient. Then there was a lot of disturbances also. The
Yes,
call
yes, ma'am.
was coming to the floor nurse. So
Yes, ma'am.
handed over the we cannot say handed over the patient. The file was handed over to the floor nurse.
Yes, ma'am.
So,
Now I got.
Okay. Do you think we could have prevented it?
Yes, ma'am.
Other way?
Yes, ma'am. Now I realize, ma'am, I would have waited there till Needu came back, and I would have handed over. I would have shown the patient to her. But
But it didn't happen.
yes,
Oh.
ma'am.
Okay. So first failure in our safety checks. So next was, I think I would like to ask Neetu, who took the patient to OT. So Neetu, you were taking the patient to OT to OT2, is it? Isn't it?
Yes, ma'am.
So,
Actually, there were a group of patients and bystanders were there, ma'am. I told her to come inside the nurse's room, but I thought I would take the case file first, and we will see the patient after that.
so how did you call the patient to OT? To which OT? What was the procedure that you followed to take the patient from pre-op to OT?
Ma'am, actually, I got a call from OT, urgent call. That's why I called Elsa to go back, and I will call her if there is any doubt. At that, when I came back from the OT, I got another call from OT4 and instructed to call the patient for the cystoscopy. As I was aware that the cystoscopy patient's name was Lakshmi, I called out the name Lakshmi, and the Elsa shifted that patient Lakshmi. She came to me and clarified with her the name. I asked what is your name. She replied that I'm Lakshmi, but I didn't check the UHID number or anything, ma'am.
So you just called the patient by name, is it right?
Yes, ma'am. I just only called the name.
Okay. So then, so you called the name by Lakshmi. Then what went wrong there? What do you think? What went wrong?
I didn't cross check with the UHID number or the procedure or case file anything.
Was there any other patient
Identified
with
by
the
the
same
name
name?
only.
Was there any other patient with the same name? Lakshmi?
Ma'am, then only I came to know that there was 2 Lakshmis there.
Okay. After taking this patient only, you came to know that there was another Lakshmi in the
There
pre-op.
was another Lakshmi posted for another case.
Okay. So this is the second step. Do you think we could have prevented it?
Yes, ma'am. If I take over both file and the patient, this may not be happened.
Not have happened. Okay. So let me ask Kala, who was the scrub nurse. Kala, now you took the patient to the table and you were the scrub nurse. Am I right?
Yes, ma'am.
So you were the scrub nurse. So what was the procedure that followed in the OT before actually getting into the procedure?
Before the procedure, we will be doing sign in, ma'am. Sign in and timeout will be carried out inside the OT. But I just took handover from the Needu, took patient from Needu by just calling the name, and I was unaware that there were 2 patients naming Lakshmi. When I asked the patient regarding her surgical site, she told as private part. So I assumed it is the right patient.
So you were familiar with that OT, or you were working in some other OT usually?
Usually I work assigned in an emergency OT where we don't always comply with the sign in and timeout procedure. So I was failed to follow the timing and sign in and timeout here also, ma'am.
So after just asking the name and the procedure was started, isn't it?
I acknowledge my mistake, ma'am. I just called out the name and I didn't check the identity or proper surgical site or procedure regarding the patient.
So when did you come to know that it was a wrong patient?
After the procedure, when
the doctor identified there was no problem.
No problem in the urinary bladder. Then only we checked all the details once again, and we came to know that we committed the procedure in a wrong patient, madam.
So you also understand that it was a preventable mishap that happened.
Yes, madam, it was preventable because identification of patient is the first and foremost thing in patient safety. It was our failure to follow all these safety priorities.
So, Lijo, you are looking after quality. So, what can we do something to prevent, at least in future? This was a serious mistake, and this definitely is going to cause a lot of issues, legal issues, and other problem to the institution, to the surgeon, to the scrum, because it is a shared responsibility as an OT team. So, how do we correct it, and what can we do?
Actually, we had done a thorough root cause analysis of this particular issue. And it was clear that the proper handing over, proper follow-up of the surgical safety checklist was not happened in this particular case. So being a quality person, ma'am, I think we should plan on the analysis of similar events which had happened during the last 1 year or at least 6 months. And I think we can identify if there is any common flaws or common mishaps in any of the cases. And if so, we will try to cover that first, so that at the earliest we will be able to prevent such sentinel events, ma'am.
So I think there were 3 areas where we fail to have safety protocols, isn't it? There are 3 areas.
Yes, ma'am. Yes.
Okay. So we would like to improve upon it, and we don't want, we will not like to have another incident like this. So can we have some awareness, some proper handing over, timeout, and all that?
Exactly. Ma'am, actually, we are planning, along with the analysis, I'm planning for an audit to see whether the staffs are aware about the 2 identifiers, that is the patient name and UHID, hospital ID number. Because many of the staff will be using only the names or at least the room numbers. So it should be prevented at any cost, and we should audit and find whether all the staffs are aware about the importance of these 2 identifiers. And also we can check the adherence to the surgical safety checklist, the boards and OTs. I think we can do some surprise audits also to see whether the timeout is being properly followed inside the OT, which is a dry area where we usually will not feed into. So I think along with the analysis, we will do an audit so that we will be able to identify the cause and we will be able to know exactly where we are. And then I think we can add accordingly.
So there were a lot of disturbance also, I think, while the handing over, multiple phone calls coming, crowd and all that. So we should look for a process in order to prevent that also.
Exactly. Here also, I feel like that there is the proper process and the everything is there, but there was a lack of adherence to the existing process. That was what happened to this particular case, because handing over was happened in a place away from the patient. So if it could have been done near the patient by seeing and checking the patient, then I think almost this error should have been prevented. So what I'm planning is, ma'am, with the help of the training department, we will arrange some nursing CNEs, and through that we will be able to cover a large number of population, and we will try to incorporate this as our next weekly objective. That is the 2 identifiers, properly using 2 identifiers as well as proper adherence to the surgical safety checklist. So we will do the training accordingly, ma'am.
So can we have a proper process for the handing over, timeout and all that? How are we going to train the staff in further? Have you planned something?
Ma'am, regarding OT, I think we should allocate some OT senior personnel like OT administrator or the technician in charge, supervisor, whoever is there as a senior person. We can allocate, we can train them and let them train each of the population over there. Because OT staff, we won't be able to come for the common CNEs which we usually conduct for ward and ICU nurses. So we will allocate certain people inside the OT and let them take 1 hour of their duty timing, or even before or after the duty timing, so that they can get trained. Because we have a short span of time, and within that time we have to cover large number of population.
Okay, so you mean to say we can have a focused training in the focus?
Exactly.
Okay. So can you show the proper process?
Yes, actually, I think the format of our OT list should also be changed, because usually we are having a soft copy as well as a hard copy of the OT list. But any patients who are coming for more than multiple procedures, same procedure patients, or at least the same name, patients with the same or sound-alike names can be highlighted in the surgical OT list daily. Because what we usually do is the next day's OT list will be updated on the previous day afternoon. So once they are preparing the OT list, they can just have an highlighted portion for patients with same procedure, same name, or even the sound-alike name. And whenever that patients on that highlighted category reaches the pre-op area, at least one of the senior person, that is either the OT administrator or the supervisor, should also be involved for the proper handing over, so that the right person will reach the right time and the right OT without any error. So I think that will be one of the best ways through which we can eradicate these sentinel events in the near future.
Okay, so now the incident sentinel event has already taken place. So now there is no point in concentrating on the person and what went wrong and who made the mistake. So we should have a robust process in place. So we should always concentrate the right process on the right process and training and making them aware. So can we have a process, proper process, or we can train them in the form of a role play? So have you planned something like that?
Yes, ma'am. I think with the
right
with the analysis, with the audits on two identifiers and surgical safety checklist adherence, with proper CNE and conducting the weekly objectives. So I'm spreading awareness to maximum number of staff within a short span of time, and with bedside handing over, both visual and verbal handing over, I think we will be able to rearrange all these problems, and we'll be able to follow a proper method of patient identification. So, and ma'am, after implementing this, maybe after 2 weeks or 3 weeks, we will do a re-audit to see where exactly we are, and we can change the process accordingly. I think after all these implementations, we will be able to prevent such errors.
So, Rijo, after a week, so how was it after the audit?
It's fine. I think we can move to, we can show them that how it has been corrected, ma'am.
Okay, go ahead.
Confirming the patient with the name and MR number. Patient name Meera Via.
Patient name Meera Via. MR number 1, 2, 3, 4, 5.
MR number 1, 2, 3, 4, 5. Verified. Identify the site and site.
It's right lower arm.
Name of the procedure.
Cyst excision.
Consent obtained.
Yes, consent obtained.
Site mark.
Yes, it's marked.
Anesthesia safety check completed.
Anesthesia checklist complete.
Pulse oximeter on patient and functioning.
Yes, pulse oximeter is on patient and saturation is 100.
Does the patient have any allergies?
No non-allergies.
Difficult airway or aspiration risk?
No any difficult airway and no aspiration risk.
Risk of more than 5 ml blood loss?
No, there is no anticipated blood loss.
Blood kept ready?
Yes, it's arranged.
Serology status done?
It's negative.
Verified. Verifying the patient. Patient name Meera Via.
Meera Via, MR number 1, 2, 3, 4, 5.
MR number 1, 2, 3, 4, 5.
Yes, confirm.
Confirm all team members. Surgeon,
Dr. Manoj, General Surgeon.
anesthetist,
Dr. Alicia, anesthetist.
scrub nurse,
Jansi, scrub nurse.
verified. Surgeon and anesthetist verbally confirm the patient. Patient name,
Patient name,
Miravia.
Miravia.
site and site.
Right lower arm,
Procedure,
cyst excision.
verified. Surgeon, any anticipated critical events?
No critical events anticipated.
Anesthetist, any patient specific concerns?
No specific concerns.
Scrub nurse, has sterility been confirmed?
Sterility confirmed.
Are there any equipment related issues or concerns?
No equipment issues.
Has antibiotic prophylaxis been given within last 60 minutes?
Antibiotic given.
Verbally confirming the name of the procedure.
Right lower arm cyst excision.
Instrument, sponge, needle counts are correct.
Sponge, instrument needle count, correct.
Has the specimen labeled including patient name?
Miravia, MR number 12345. Specimen labeled as right lower arm cyst.
Verified. Were there any equipment problems to be addressed?
No equipment issues.
Verified.
Okay, thank you, Lijo. I think our training has been very effective. And so when we analyze this issue, which that happened, that could not have happened, we failed in 2-3 places. It is the process that failed, not the individual. First and foremost, we should have handed over the patient physically. That did not happen. That's the first place. Second place, calling a patient from a pre-op area to OT should have been with a proper identification. Here, what went wrong, I think, is only name and the procedure name was identified. So, cystoscopy instead of cystoscopy patient, the procedure was identified as cystoscopy, and the name Lakshmi. Unfortunately, we had 2 patients with the same name. So naturally, this patient who was very apprehensive about the cancer cervix must have gone inside first. So instead of this double verification and other things, patient went inside the OT. And then the third safety check, where we could have prevented, definitely prevented by the proper timeout procedure. So that also did not happen there. So that is why it happened. So by doing this, even if it fails one or first place or second place, definitely in the third place through the proper timeout process, we can ensure the safety for a patient who comes into OT. Because once the patient is induced, they cannot react, they cannot say anything. So it is our responsibility as a team, healthcare team, to ensure that the patient who comes inside OT comes as the right patient, the right surgery, and right side of the surgery. And it is very much preventable if we all adhere to the process that is available to us. So thank you for an effective training that happened, and role plays. We trained the staff using the role plays. I think that helped to improve the situation in a much better way. So thank you all.
Thank you.
And now over to Madam Tankam for the analysis.
Okay, thank you so much. And first of all, hearty congratulations for bringing in that video, because seeing is believing. So I'm very sure the audience today here have benefited a lot because of the recording that you have shown today. So I'm sure they could see what is happening. So all of us know that this can happen anywhere. And all the hospitals, they have set protocols. Everybody will say we have surgical safety checklists, we have pre-operative checklists. So exactly the way that the team has presented, despite having everything in place, things can go wrong because of many factors. Like in this particular discussion, I just want to highlight some of the things which are little unusual, like in the sense, I think it was Elsa who mentioned that when I went there, there were a lot of, disturbance. There's a lot of relatives sitting around. So one of the things the WHO insists is to look at the human factors around errors. Apart from the person, what other thing could have gone wrong, because distraction is one of the common, human fallibility. I can say when we get distracted, we may not focus. Just telling someone don't get distracted is probably not the right way to address a problem. So maybe that hospital will also try to see that can we keep the relatives away from the, receiving bay. Now, when you are receiving, like in the video you showed, second time when the patient came in, there was no disturbance. The patient was there. And I was very happy to see the patient, though I could not hear in the second video. The patient was telling. Now, WHO talks extensively about involving family and patient and family in everything. So in this video, very rightly, the patient was involved, asking him that, so if you look at some of the powerful videos that WHO has released, there, when a patient comes in, I'm just trying to, give a little bit more pictorial explanation to what the team so well explained and showed, is that every hospital will have a pre-op checklist where the patient is being, shifted from the ward to the OT. So the pre-op checklist is being filled. I'm telling this from my own experience. So we had a pre-op checklist. Then we realized the process was written that in the ward, that patient, before the patient is being shifted to the OT, assigned nurse and the team leader should double check the patient once again. They have the right patient, they have the consent, they have the images, everything. So we had that checklist. I'm talking about my Fortis experience. We had that, but we realized sometimes team leader is very busy. OT says shift the patient right now. We are so busy. So what we did was that, we ensured that the TL will countersign the pre-op checklist, because there are two things. One is one segment of checking happening in the ward itself before the patient is being shifted. And then in the same form, the OT nurse will receive the patient. While receiving the patient, exactly as you showed in the video, ask the patient. Don't ask the patient, are you Lakshmi? Ask the patient, please state your name. They will tell their full name. And UHID, most of the Indian patients will not remember. So you need to use the ID band. So patient told the name. And second thing that they advocate is that asking the patient to tell what is the procedure that they're going to undergo. So in the language that they can understand. So you ask the patient, what surgery are you undergoing? Or ask the patient in Malayalam, Ningalde innate operation endana ennu chodikkanam. So that means patient will tell, I am supposed to have this surgery. So you know that this is the right patient. Patient knows what's the surgery. And the third important question, show the consent paper, ask the patient, did you sign this consent? Is this your signature? This is a very important step that, I have seen in many outside hospitals. They are continuing to put in, because what happens, errors are waiting to happen. Like Bina told, multiple steps, there are safety moments. But when all those safety moments somehow get violated, the error reaches. So maybe the ward nurse, I'm sorry, I'm forgetting the name, Elsa and Neetu could have stopped it. Happen. Maybe the OT itself, Bina already explained all this. So there were many steps. So what happens, involving the patient will give you that power to say you have the right patient. And if the patient is not conscious, the relative comes, ask the relative to say, what is your patient's name? Do not provide the information. That is what, it's like, I should not ask Lijo, is that your name? And if the patient is not distracted, he will say, anyway, he's already anxious about what is happening. So you're not supposed to ask the patient. And the same process is to be followed when you're giving medications or anything. You do not call out the patient's name. You ask the patient to state their name. And so beautifully it was showed in the final. I must congratulate the team, Kim's team, for getting all the doctors agreeing to the video, and you are sharing such a powerful video. And when I was looking at it, and I was hoping this will be the real case in all the hospitals across the country, the safety level will definitely go up. We all are human beings, we all are being rushed, but spending that few moments of stopping, pause. Timeout is about pause. The circulatory nurse is supposed to say time out and then stop everything and then start having the dialogue. Before that, the sign in. Sign in, some hospitals could happen in the pre-op area, where the anesthetist is supposed to come to the patient along with the nurse and do all those sign in questions. Ask the patient, please state your name. Did you give the consent? Tell us your surgery, and then check the site marking. And then Veena very correctly said, once the patient is under anesthesia, there is no way he can tell you what is his name and what is the surgery that he is supposed to go. So if the error is initiated, it will continue to complete. Just like in the case study, if there was a dialogue with the patient, whether they are rural or from whatever background, they know what is to be done to their body, provided they have been explained well by the surgical team also at the time of consent, what surgery is supposed to be done. So I would say congratulations to the entire Kerala team for discussing this and showing visuals. And that was very, very powerful. I have seen these videos abroad, not in India. They do this. And I thought it was a very safe, practice to have. Ask the patient, please state your name without giving the patient's name. So you can verify with the file whether you have all the right things here. And when looking at the images also, very important to verify that you have the right images. So if there are two femoral artery bypasses happening, the wrong message, the image cannot be there. So that is one more, area that one needs to pay attention. What is the UHID and name displayed on the image? That's very important. And there are a lot of, safety events. If you go into the YouTube or into the Google, you will see a lot of such, So I have an interesting question to the audience. On behalf of Kerala team, I will ask that, how many errors did happen in this case? You can write, you can just type in the chat box, how many errors happened? 1, 2, 3, 4, 5, 6. How many errors happened? Thank you. Appreciation is coming. Very good. I want to know how many errors happened. People are saying, no, we don't like to take the risk. We better leave. We already finished the learning. So, okay, nobody is taking the risk of saying that, how many errors happened.
We ourselves can say, we admit the mistake and say 1, 2, 3, 4, 5.
Oh, Anagha is talking about 6 errors,
Yeah, possible.
Okay. So if you look at all the patient, rights itself, you will see everything was violated.
Yeah.
Right? The wrong patient, the wrong procedure, the wrong site.
Right.
So the wrong consent. So everything happened was wrong. So whenever there is one mistake happens, there is one more mistake.
Series of mistakes. Series of mistakes.
Minimum, the wrong patient and wrong procedure did happen. So I'm glad that many of you are answering that 6 for. It's not important to know absolute. It's important to understand that it's not just wrong procedure we are talking about. It is the harm that is done to that particular patient. Right. It's a classical Swiss cheese model of how errors finally happen. When all the things that can go wrong, when they get aligned, the harm reaches the anybody in the system could have, Sorry, somebody is very excited. I want to mute that. Okay. Somebody is very excited and saying, let's do the correct procedure in the OT today. Okay. So they are already discussing maybe. So no, we should do that exactly. So my friends, Kerala chapter, thank you so much for conducting such a wonderful Empower Hour. And before I say thank you to each one from Kerala chapter, Manju and Beena, Isha, Kala, I'm just trying to remember all the names, Lijo, Neetu, all of you did wonderfully well, and this is much better than, just coming and telling what needs to be done. Everyone knows what needs to be done. It's very important to discuss that how things can go wrong. That's why patient safety is the paramount reason that healthcare exists, because that's the first thing that is required, that give safe care to our patients. After that, all the other paraphernalia can happen. The first and foremost is safe care. And so before we wrap up, let me also give good news that in September, we will have our next major activity, that is our annual patient safety virtual conference that will happen on 30th of September, and on 29th September, we will be having the project presentation from ANEI Patient Safety Fellows. For all your information, we have a collaboration with Patient Safety Movement Foundation from USA, and with them, we are doing this fellowship program. This is the second cohort, and they are already doing quality improvement projects, which they will be presenting. And we are lucky that Dr. Michael Ramsey, CEO of Patient Safety Movement Foundation from USA, has kindly consented to be present when our fellows are presenting their projects. That's a matter of honor for our association. And very soon, we will also be announcing for the application of the third cohort. So there is a lot of activity that we as an association do to contribute to improve the patient safety across India in all our hospitals. And all the chapters, they are stepping up to come here, spend time, prepare, and discuss, because it's not overnight job for any chapter to do all the scripting and then come here and present. It takes effort. And thank you, Kerala Chapter, for taking extra time doing those videos. They were very powerful. Thank you very much. Now the entire thing is recorded. And thank you for those who are present here and those who are not present here. This video will get uploaded on ANEI's YouTube channel, and anybody can go and watch and learn, show to your team members. It's very important. And continue giving safer care to our patients. Thank you so much. And we will see you on August 12th, 11 a.m. again, when Maharashtra chapter will be presenting a case around alarms. It is about how safety needs to be, practiced around patient alarms.